Well, good morning, everyone. Welcome and thank you for joining our Healthy Living Lecture event on unlocking the power of HAP Medicare through Henry Ford Health, hosted by Henry Ford Health's Senior Healthy Living Program. My name is Danny Lopez, and I'm the Director of Medicare Sales and Member Retention at HAP. I will be your moderator for today's lecture. For those who are not aware, HAP is a proud member of the Henry Ford Health family, making the health system one of the few integrated health systems in the state whose healthcare provider and insurance company are owned by the same organization. This morning, you'll hear from Kyle Ingraham, Manager of Medicare and Individual Sales at HAP. In the next hour, Kyle will discuss Medicare plan basics of the Annual Enrollment Period, also known as AEP, which runs between October 15th and December 7th. He will also cover the different parts of Medicare Parts A, B, C, and D, as well as the exciting new coverage updates launching this month exclusively for Henry Ford Health patients. Following Kyle's presentation, we'll have a question and answer session as well. So if you have a question during or after the presentation, please type your question into the chat box, but please do not share any personal medical information. Also, to ensure a smoother experience for all, please turn off your camera. Note that your microphones have also been muted. This lecture is being recorded and will be available to listen to again on the Healthy Living Lecture Series webpage at henryford.com/Healthy Living Lectures. Now, I'm happy to introduce Kyle Ingraham.
Good morning, and thank you very much, Danny. Very excited to be here with you all today to go over the Medicare basics, AEP, and everything else that goes along with that, along with our great partnership with Henry Ford Health and plan options that we have this year. Get my screen working here. There we go. So what we're going to cover today is, what is Medicare? How much does it cost? What does it cover? Your options? How do you choose what's best for you? What is Part D? And then, of course, kind of the next steps as we go into this annual enrollment period. So first and foremost, Medicare is an insurance provided by the federal government based on FICA taxes paid into Social Security. It's administered by the Centers for Medicare and Medicaid Services, or as we call it, CMS, because in insurance, we love our acronyms. Referred to as Original Medicare, that's your red, white, and blue card. That represents your Part A and Part B, which we're going to talk about a little bit more here in a few slides. Eligible beneficiaries are those that are 65 years of age with enough credits based on quarters of taxes paid by a beneficiary or their spouse. Any age with end-stage renal disease or ESRD or Lou Gehrig's disease, ALS, and individuals with certain disabilities defined by Social Security. So, and for you to qualify for Medicare with Social Security, you do have to be defined as disabled for at least 24 months. There are penalties for not turning on Part B when you become eligible unless you have credible coverage. So that's something you want to keep in mind. If you are working past 65 years old, you became eligible, you have to take a look at the size of your group. Do you have 20 or more employees? Then you don't have to take Part B. If you have less, you do have to take Part B. So it's something to always keep in mind and talk to your human resources about. So how much does it cost? That's a great question. I'm showing you the 2024 pricing as CMS has not yet released what Part B premium is going to be. But you pay, you get Part A no matter what, as long as you had 40 quarters of taxes with no premium. Less than 40, there is a premium that goes along with that. Part B is the one that you hear everybody talk about. I pay my Medicare, it comes out of my Social Security check, or I pay it quarterly. That's typically what everybody's talking about, and that's the Part B premium. In 2024, that is $174.70. But one thing to keep in mind is that this is income-based for how much you're going to pay for Part B premium. So they look at your income from 2 years prior. There's a little bit of a look back period there. And if you, as a single individual for your tax return, are making $103,000 or less, then you're going to pay the standard Part B premium. If you're filing a joint tax return, it's $206,000 or less, then you're at the standard Part B premium. But if you are making above those thresholds, and we have it broken out here for 20 and 24 that you can see, there could be an increase to that Part B premium. So that's something that can take some people by surprise when they're going through the enrollment process into Medicare, is all of a sudden that first withdrawal comes out of Social Security, or they get a letter saying that they're being charged what we call an IRMA, and now their premium is a little bit higher. So it's important to know that it goes on a 2-year look back. So if you have retired recently and your income is not at that level anymore, it's not something that's going to stay with you forever. That IRMA can be removed and you can go back down to the normal Part B premium. It is just looking at the tax returns from 2 years prior. So what does Medicare cover? You have 2 types of Medicare, as we mentioned, for original Medicare. Part A is inpatient hospitalization. So if you just have original Medicare, nothing else to go along with it, you have a $1,632 deductible per incident for that inpatient hospitalization. It's also covered under skilled nursing facilities, and some home health care is under Part A. Part B is your outpatient Medicare coverage. So think of that as your PCP, your specialist, physical therapy, can even be the urgent care. It can be any of those things that aren't part of the inpatient experience at the hospital. That has a $240 deductible per year, and the cost share is really 20% of whatever it costs to you. 80% is covered by Medicare, 20% is covered by the beneficiary. So those are just the originals parts of Medicare, Part A, Part B. The problem is that with just those 2 things, there's no maximum out of pocket. So there's no backstop on what you can spend in a year on those services. And then there's also no coverage for prescription drugs, vision, dental, hearing aids. None of those things fall under Part A or Part B. So what do? You really have 2 options when it comes to, as you would say, filling in the gaps with Medicare. So the first option is a Medicare Advantage plan that you've been hearing a lot more about in the news cycles. You've seen people on TV talking about Medicare Advantage plans. That is called Part C coverage. And what Part C does is it really wraps in and takes over the administration of your Parts A and B benefits, and also includes in some additional things. So all the carriers that offer Medicare Advantage plans have to have contracts with the federal government. Plans are designed by each individual carrier. There's low or no monthly premium. The big thing you've been seeing in Medicare Advantage plans these days is 0 premium. The thing to remember, though, is that it's 0 additional premium because you're already paying your Part B premium. So a lot of times I hear people say 0 is too good to be true. Just remember, you are still paying that Part B premium that's going towards your Medicare coverage. Choose your network that fits your needs. Do you like staying within one system? I might be preferable to, the Henry Ford system. So you can have an HMO that's going to be a defined network that you can use, or a PPO, which really allows you to stay either within the defined network for lower cost shares typically, or you can see somebody out of the network for a different cost share. Most of these plans include Part D coverage. So that is your prescription drug coverage. That is something you want to make sure that you have, because if you don't carry a prescription drug, and we will talk about it, there could be a penalty there. Plans also include additional embedded benefits. So dental, vision, hearing, it can be over-the-counter goods. A lot of different things can be wrapped into these Medicare Advantage plans. And the whole guise really is to try to make you healthier by providing these options in the future. To enroll into these plans, though, you must do so during an eligible enrollment period like the one we are entering into right now. The other option is a Medicare supplement. You may also hear it referred to as a Medigap plan. So CMS has designed and administers what these plans can look like, right? If you purchase a Plan G from HAP, the coverages is going to be on the basic plan design exactly the same as it is with another carrier. So those plans are standardized. They have monthly premiums. There's no $0 med sup out there. So just keep in mind, those premiums also tend to go up year after year as you get older. So what seems like it's a lower cost now, when you're 83, 84, 85, that can become a much higher monthly cost. But the upside is you're not paying anything when you go to the doctor with a lot of these plans. You may have a deductible you have to pay, maybe a small copay depending on which plan design you're on. but you're not getting a whole bunch of different bills coming in. So you may have a higher premium, but uh, you aren't having to have the big bills that you have to pay if you go to the hospital or something else, as opposed to a Medicare Advantage plan, which again, I'm a little bit more partial towards the Medicare Advantage side because I don't have to pay upfront every month and kind of hope that I'm using my insurance at some point in time. I'll have a cost share when I go to the doctor if I need to go to the doctor. The other part is a lot of the Medigap plans have no added benefits to it. Some do have maybe the option to buy up, a vision or dental plan along with those, but it's not embedded into the plan. And the other nice part is you can apply any time of the year, but you may be subject to medical underwriting. So if you decide mid-year you're with one company, you want to move to another company's Medigap plan, you can do so that at any time, but again, you're going to go through medical underwriting at that time. So how do the options work? You start with Medicare Parts A and B, and then you take it from there, decide how you want to handle filling in those gaps. Is it going to be with a Medicare supplement or a Medigap plan? And also getting that prescription drug coverage that you're going to want along the lines of that? Or do you want to wrap that all into a Medicare Advantage plan known as Part C, where you can combine Parts A, B, and D into one simple plan for you? So how do you know what's best for you? It's funny, I actually just went through this same conversation with my dad when he entered Medicare last year, and we sat down and we had to ask ourselves, are you okay with staying within a network, or do you want to be able to go outside of a network? Do I need to purchase a different plan? Do I want it covered by a Medicare Advantage plan for my prescription drugs? Has anything been going on lately? Do you have to think about, is there potential for future hospitalizations or surgeries that are upcoming? What are your costs going to be? This is something that you need to take a look at, I feel like, every year, just to make sure your plan is still fitting what you need. And then, do you need or want those additional benefits, the dental, the vision, the hearing? Because again, if you're on a Medigap plan, for example, you may have to pay for some of those things out of pocket with no cost share help, where a Medicare Advantage plan may give you allowances or cost share for certain services under dental, vision, and hearing. And then Part D, prescription drugs. This has been a huge thing going into this AEP. And candidly, I think if you are currently on a prescription drug plan or a Medicare Advantage plan with prescription drugs covered, you need to either call us here at HAP or reach out to your agent to have your plan reviewed, because there's been a lot of changes with prescription drugs this year under the Inflation Reduction Act. But prescription drug Part D is standalone prescription drug plan, as we mentioned, a PDP. I said we like our acronyms in insurance, or included into your Medicare Advantage plan, that Part C plan. But you have to, like every carrier, no matter it's a PDP or a Medicare Advantage, we follow something called a formulary. And though Medicare does dictate the minimum standards of what has to be covered on a formulary, all carriers cover drugs differently in a more robust fashion. So you want to make sure that you're taking a look at that formulary to understand, are the medications you're currently on covered by the plan that you're looking to enroll into? And I had mentioned the Inflation Reduction Act. So there's two major things that have hit us in 2025 that affects all Medicare beneficiaries. And one is the cap for prescription drug costs for your out-of-pocket costs. That's going to be $2,000 this year for prescription drugs. A lot of people, if you're on Medicare, if you know somebody on it, they've heard of the dreaded donut hole, where all of a sudden, if they spend a certain amount on their prescriptions throughout the year, now they have a much higher bill every time they go to the pharmacy. That is now going away in 2025. And the most you will pay out of pocket for your prescription drugs is $2,000. That applies to the deductibles and the cost share you pay at the pharmacy. And it only applies with drugs covered by your plan. So I know a lot of people say, I'm on an expensive drug, I'm using GoodRx or another one of these coupon programs. The money you're spending towards those drugs through those programs are not counting towards that $2,000. The other thing that's come in this year is the introduction of the Medicare Prescription Payment Plan, or what we're calling the M3P. This allows you to spread the cost of your prescriptions over the course of the year. But CMS did release information that only those with drug costs of about $600 a month are truly going to benefit from this payment plan. The reason is that you go to the pharmacy and say you're on a tier 2 drug that has a low copay, really doesn't make sense to spread that across a year. Especially as you may get put into different drugs, that billing actually is going to end up looking a little variable month to month, as some drugs, you need every month, some drugs are occasional use. So it really, unless you're going to have that high cost share in a month, I don't see it benefiting as many people as it could. But the main thing is to know that it's there and available for you, and your company will be letting you know, whether it's a Medicare Advantage or a prescription drug company, how you can enroll into that plan if you would like to. So next steps. So the first question, are you near in an enrollment window? So make sure you don't miss those windows when they come up. Penalties and delays can occur if you do miss those. Or are you looking ahead to your retirement, turning 65? You want to make sure that you're marking your calendar for when that enrollment window is going to open up, and make sure that you're reviewing your plan options well before. If you're close to turning 65 right now, I'm sure I don't have to tell you your mailbox and email and phone calls are probably getting blown up with advertisements everywhere. But it is a good time to start taking a look at all your options so you're ready to go when you turn 65. So the different enrollment periods, you have your initial coverage. So that's 3 months before the month of your birthday, the month of your birthday, and the 3 months following. So you have kind of that 7-month window to make one election into a plan. So a lot of people think that it's kind of like the annual enrollment period, where whatever the last application you put in that window is the plan you'll be on. You really only get to make one choice within that 7-month time frame. So that's why I say, make sure you're taking a look early and that you're ready to enroll into a plan when you can. If you enroll in those months prior to your birthday month, your plan will become effective the first day of your birthday month. So for example, if your birthday is October 15th and you enrolled in August for a Medicare Advantage plan, that plan would be effective October 1st. So technically you get a little bit of coverage before that 65th birthday. If you enroll during the month of your birthday, it becomes effective the first day of the month following your birthday month. And then any of those 3 months after your birthday month, it just becomes effective the first day of the month following the month you enroll. There's also the initial coverage gap. So that is first 3 months leading into in the month of that you are, say, getting your eligibility into Parts A or Part B. And then there's a special enrollment period, which is typically going to be 60 days before and after the qualifying event happens. So what we see the most of this is a few different situations, such as you're retiring and you're losing your group coverage. You can enroll into a Medicare plan 60 days prior to or 60 days after the date that you actually lose coverage. You also will see this when somebody moves into a new state or into a new service area. They have a special enrollment period for that as well. Also, qualifying for Medicaid or losing your Medicaid coverage will also open up that special enrollment period, as well as a few other less used situations. Then you have your annual enrollment period, which we are technically going into right now. So one of the great things about today is, as of October 1st, all plan information is now public. So you can go on Medicare.gov, you can go on HAP.org, you can go to the different sites and see what plans are available for 2025. The actual enrollment into that plan, though, cannot occur until October 15th, and you have from that date through December 7th to make an election. This is the one time of the year, though, where it's the last application in on December 7th counts. So if you enroll into a plan and then all of a sudden you take a look and you go, actually, this other plan looks like it's going to fit for me, that's fine. You can still enroll into that other plan. As mentioned, it's just whatever that last application that was submitted by the end of the day, December 7th, is the plan you'll be in on January 1st. And then there's one more enrollment period, and that is open enrollment. That runs from, and it's really the Medicare Advantage open enrollment period. So that goes from January 1st through the end of March. And what can happen there is you can go from one Medicare Advantage plan to another Medicare Advantage plan, or you can go from Medicare Advantage back to original Medicare with a prescription drug plan. The only thing you really can't do in that time frame is go from original Medicare with a prescription drug plan to a Medicare Advantage. that would have had to have occurred during the annual enrollment period. So how can HAP help? HAP and Henry Ford are here to reduce your costs when you're seeing your providers. So one of the main ways we're doing that is by launching our co-branded plan with Henry Ford with the Henry Ford Select plan this year. I encourage you all to go to that web link right there, which is www.hap.org/Medicare to actually look through the full plan design. But what I can tell you is that we have taken a look in that plan to reduce the cost far below what we're seeing in the market. When you're going to the emergency room, when you're going to urgent care, your specialist cost share on the Medicare Advantage plan is going to be much lower than what we have had in the past. And part of that is this family relationship we have with Henry Ford Health, and we want to pass that along to the patients and members that we have within that system as well. So please, I encourage you to go take a look at that plan. There's a lot of the great benefits like flex card benefits, dental, vision, hearing, all of those types of things are covered into that. So go to www.hap.org/Medicare to see those plan options. And also, I highly suggest that you review your plan options with a licensed agent. So you can call in here to HAP, and we'll make sure that we get that phone number out at the end of this during Q&A, or you can go on hap.org to take a look, or speak with your local agent. If you are already working with an agent locally, I highly encourage you to reach out to them and talk to them. Ask them to walk you through the Henry Ford Select plan to see if that's going to be a good fit for you. Chances are we partner with them. We love our independent agents here in Michigan and are always happy to partner with them to make sure that we're helping you get into the right plan. And from that, I'm going to turn it back on over to Danny to see if there's any questions that we have.
So looking into the chat, going to pull down any questions we have to help provide responses. Yep, so I see there is Maggie Jackson. To speak with an agent about HAP Medicare, please call 866-802-3634. So Maggie is asking if we can talk more about the Henry Ford Select plan.
Yes, absolutely. So the Henry Ford Select plan is an HMO plan. So the caveat of that is that you're just staying within the Henry Ford and Ascension networks are going to be the facilities that are within that plan. It has a $205 flex card, which can be used either to help pay your copays when you go to the doctors. And that flex card, excuse me, is a quarterly flex card. So that allowance rolls over quarter to quarter. You can use it towards OTC items, healthy foods, or as well as cost share at your provider's office. So if you're going to a specialist and have a copay, you can use that flex card to pay the copay. It also gives $2,000 in dental allowance, up to 100% coverage for things like root canals or crowns, up to that $2,000. So very robust plan on that side. And when you're looking at cost shares, a $15 specialist copay, $15 urgent care copay, very low copays that we're going to be able to provide the members on that plan as well. So as I mentioned, caveat is it's the Henry Ford and Ascension networks that are going to fall into it. But the good news is chances are if you're on this call, you're already part of the Henry Ford family, and look forward to working with you.
Thanks, Kyle. So there's a couple more questions about the plan. Cheryl asks, is this only available to Henry Ford employees?
No, this is not available to only Henry Ford employees. This is available to anybody who lives within the seven county area for the Henry Ford Select, which is Jackson, Oakland, Macomb, Wayne, Genesee, Lapeer, and I'm missing one, but you can see all those counties at Henry Ford at hap.org/Medicare. Hillsdale, thank you, Maggie.
And then there's another question about the specialist. So there is a patient here whose husband sees multiple Henry Ford specialists, but as a primary care provider that's not in the Henry Ford network, would he be eligible to be a part of the Henry Ford Select plan?
So all of the PCPs and specialists do have to fall within the network. I would encourage you that you can go into hap.org and use our Find a Provider tool and just make sure that that provider's not in network. Before we have other great plan options where they probably are, but for the specific Henry Ford Select plan, I would highly encourage you checking hap.org, Find a Provider tool to make sure that that provider is or isn't in network.
Thanks, Kyle. So a few more questions are coming in. I'm looking at the MSU healthcare HMO plan, which has a $140 flex card. Is this split into categories? We had HAP last year, and our card was split into half dental, vision, hearing, and the other half for OTC. So I think I know your answer, but I'll let you go ahead and drive it home.
Yeah, that is a change for us this year. We listened to our members and that they didn't want to have those different categories. So we did remove the categories this year and moved it to a quarterly benefit. If you're using it on one of the qualifying benefits, you can have that whole purse to use towards it.
All right, so a couple different questions here. I think the word maybe was working, but it says I'm going part time, so maybe working part time. My husband is on my plan now, but thinking he should go on Medicare instead. Is that a qualifying event?
Yes, so losing group healthcare, whether it's voluntary or involuntary, is a qualifying event to enroll into Medicare.
Another question: is there a no cost premium for HMO Senior Plus?
The HMO Senior Plus, so that's a good question. We've changed naming conventions for the last few years. So if you're looking on the website today for the Senior Plus HMO, there is a cost share. The most of our plans are $0, but a few still are. So again, if the name is still Senior Plus, then there is a premium attached to that.
And then going back, Kyle, on the county locations, is St. Clair City, or I'm sorry, St. Clair County also a part of the Henry Ford Select network?
St. Clair County is not part of that network.
Okay, so another question. I am not retiring despite becoming 65 next year. Understood. How does this play against my existing Henry Ford health benefits, including my spouse and covered children?
Great question. And that's one of the situations that all members have to take in mind that it's a case by case basis. It may make more sense for you to stay on the group plan. You know, if you're sharing deductibles and everything else, you may want to stay on that plan. Or the cost savings to coming off of that, you know, you have to look as to with HR as to whether or not you can keep just your family members on that plan and you go into Medicare. So it's not a clean, easy question that I have an answer for. My suggestion would be to sit down and talk to both your HR department and also with a local independent agent to review all your options and make sure that you're making the best choice for you and your family right now.
So still going through the chat. Okay, are there restrictions on the OTC card, like you can only buy OTC products that are on the OTC network list?
No, and yes. So uh, every company handles OTC cards differently and how it works. You know, we used to be catalog only, so you had to get your OTC benefits from an approved catalog. Now you can go to a pharmacy or retail location. Uh, we do not bring it all the way down to the product itself. It's more of where you are purchasing the product. So, for example, if you're at Meijer and you're trying to grab an item from the clothing department within Meijer, it's not going to have a SKU code to it that will fit. But if you're buying it from the pharmacy portion of the store, believe it or not, these stores are broken out on their SKU codes, so it's easy to tell. If you're in the pharmacy part, it will work. It's not going to be a defined list. So if you prefer one brand over another, you can use it for that. You just aren't able to use it for the other items available within the store that are not health related.
Okay, so scrolling through some additional questions, there was a question about can we get a copy of the PowerPoint that Kyle presented? We don't have an issue with that, so if there's a way for us to get that to you, we're happy to do that. But also, just remember this presentation was being recorded and will be housed at the Healthy Living Lectures portion of the henryford.com website. We'll give it another 20, 30 seconds to see if any additional questions come through, but these are great questions. Well, I don't see any additional questions coming through. But first, we'd like to thank Henry Ford for allowing us the opportunity to present today. Thank you to Kyle for presenting. This does bring us to the end of our event. Again, for more information on HAP and Medicare offerings, this AEP, which is coming soon, please visit hap.org or call 866-802-3634 to speak with a licensed Medicare insurance agent. As a reminder, the lecture has been recorded and will be available to watch or share with friends and family members. All you have to do is visit henryford.com/healthy living lectures to view the presentation. And the recording will be available in the next couple of weeks. On behalf of Kyle, HAP, the Senior Healthy Living Program, thank you for joining us today to